Hello, everyone. My name is Dr. Allison Gibson. I'm an associate professor in the School of Social Work at St. Louis University, and I work with our Geriatric Workforce Enhancement Program. In this video, we're going to talk a little bit about the role of climate change on healthcare. This project is supported by the Health Resource and Service Administration of the U.S. Department of Health and Human Services, as part of the Geriatric Workforce Enhancement Program. This is just a reminder that this information or content and conclusions are those of myself, the author, and should not be construed as the official position or policy of, nor should any endorsement be inferred by HRSA, HHS, or the U.S. government. So in this presentation, we're going to talk about just a couple things. My hope is that by the end of this presentation, you'll be able to summarize the health impacts on climate change, both direct and indirect. After attending this presentation, you'll also be able to discuss who is most at risk of health-related concerns from climate change. And we'll also talk a little bit about the role that healthcare workers can take to promote a response to addressing climate change. How can they support not only their patients, but also thinking about the impact they can make to the healthcare field. If you are completing this training as part of our continuing education initiative, you'll see this little QR code here prompting you. There's a brief survey that you'll need to complete as part of that. So let's get into this. Why does climate change matter? Why do we even care that this is an issue particularly related to healthcare? It's important to note that climate change is not just environmental, it's also a health crisis. I recently heard a colleague refer to this as that sometimes it is just too hot to be healthy. And I think that really reflects some of those extreme weather events that we are seeing that are a direct result of climate change. We know that many hospitals, other healthcare entities, communities are already seeing the impacts of climate change. And we'll talk about some of the evidence that already exists to support that theory. We also know that healthcare is both affected by and contributes to climate change. There are impacts within the healthcare industry that may be prompting climate change to be getting to the problem that it is, the severity that it is. And so we'll also take a look just briefly about that today and talk about what you can do as a healthcare worker to help to address that. Let's get started by talking about the direct health impacts. And where we've really seen the most evidence of this is related to heat-related illness and mortality. So with these extreme heats, extreme temperatures that we're seeing across the globe, there have been many indications that this can really impact people's ability to stay well as to even stay alive, depending on what other kinds of chronic conditions they have going on. Extreme heat has been the leading cause of weather-related deaths globally, and this is getting worse. It's especially worse for folks with chronic conditions like cardiovascular disease, diabetes, asthma, and we know that there is definitely a relationship between folks experiencing heat stroke leading to emergency room visits. Studies consistently project a substantial rise in heat-related mortality across cities worldwide under climate change scenarios. Even with partial adaptation, expected deaths increase significantly. So what we're essentially saying there is even when we try to take different steps to try to mitigate responding to this heat, we're still continuing to see an increase in deaths that are directly related to the impact of heat. Recently, we've seen some news out of Europe that heat-related deaths will exceed any reduction in cold-related deaths, even in northern climates. And this is resulting in a net rise in temperature-related mortality across most regions. And we also see that here in the United States as well. Not quite as strong of evidence of what we've seen in Europe, but I imagine as we continue to study climate change in the United States, we will also see some of these same patterns replicated from what we're seeing in other parts of the globe. We also see direct health impacts in other kinds of weather-related events, whether that be wildfires or floods and other extreme kind of water events like hurricanes. So with wildfire smoke exposure, wildfire smoke is often also referred to as fine and habitable particle matter, or PM2.5. And this has been linked to respiratory events such as asthma or COPD. It's also been linked to cardiovascular events, elevated mortality, and we especially see this in major fire seasons. So, in highly polluted fire episodes, all cause mortality can rise by up to 12% on days with high smoke concentration. So, it doesn't mean that they're coming in specifically because of a smoke issue, but they're more likely to have heart attacks. They're more likely to have strokes. They're more likely to experience complications with asthma or COPD that cause mortality. We also see, even looking at longitudinal data, even after a fire has ended, it could be months, it could be years, we still continue to see an increase in mortality, especially among older adult populations, well after that event, and it's thought to be because of that smoke exposure. When it comes to floods and other kinds of extreme storm injuries, such as things like hurricanes, severe flooding is associated with a rise in hospitalization. And this is due to infection, skin condition, injuries, and other nervous and musculoskeletal diseases in the weeks following floods. And so part of this is directly related to the flooding, right? So if a river floods, other water sources flood, we know that that water is going to become very contaminated. So if somebody is exposed to it, they have to walk through it to try to evacuate. They get swept away. They're going to experience some significant injuries related to that. But we also know folks are also exposed to a lot of that when they're doing cleanup, whether that be, digging out their basements or trying to just clean a room that was infected with kind of that nasty water, that can have a really significant impact in increasing those infections, skin conditions, and other injuries at that time. Other extreme weather events also result in direct trauma, displacement, and injuries during evacuation. And I'm going to talk a little bit about trauma and displacement here in just a second. Other direct health impacts are mental health effects. Direct psychological consequences of disaster include acute stress, PTSD, anxiety, depression, and that can be especially exacerbated for folks that live in communities that experience repeated events or where folks have had to either do a short-term or a long-term displacement. There is a lot of evidence that suggests, even going through some type of disaster event can really increase the onset of acute stress disorder. And if those aren't mitigated, that can really lead to a segment of the population going on to develop something like PTSD. It's thought that in a typical disaster event, there's probably somewhere between 15 to 20% of the population that without kind of appropriate early intervention, we tend to see these folks go on to develop PTSD. Elevated heat exposure has been statistically correlated with psychiatric hospital admissions. We also see increased aggression among those with behavioral health needs, and it rises in suicide rates. So research has found that for every 1 degree temperature rise that we see, it is linked to a 3.1% jump in monthly suicide rates. And this is especially true in regions where folks tend to do a lot of their work outdoors, especially with produce. And so we see especially that relationship between increase in temperature and suicide. Probably unsurprisingly, we're starting to see evidence of the relationship between accelerated aging and chronic health burden. A recent longitudinal study of nearly 25,000 adults found that a heat wave exposure accelerates biological aging about 8 to 12 days over a 2-year period. And this is pretty comparable to what we see in research related to looking at heavy alcohol use and smoking. So we're consistently kind of seeing that trend. We've had a couple folks that have started to look at individuals that are unhoused related to this, and they're also seeing those same trends. This population, if they're in an area that has repeated exposure to some of these extreme weather events, whether that be hurricanes or flooding or wildfires, folks among the unhoused population also seem to be experiencing some pretty accelerated aging with that constant exposure. And this is especially true when the temperatures are just too hot. Beyond aging, heat exacerbates chronic illnesses and disrupts healthcare access. and older adults are more likely to miss medical appointments during extreme heat episodes. That kind of makes sense, right? If it's really, really hot out, it's going to be a huge inconvenience for you. A lot of folks will just delay seeking, their routine medical treatment. Um, can't say I blame them. I'm not a fan of the heat myself. So when it comes to thinking about kind of those indirect health impacts, so how do we, maybe see impacts to kind of overall health, quality of life? There's a couple different areas that we seem to have a lot of evidence that's really connected into climate change. The first one I want to talk about is this idea about vector-borne diseases. So this is like when we see an increase of pests, such as things like mosquitoes and ticks. Climate change is expanding the geographic region and season of disease-carrying vectors like mosquitoes and ticks. Warming temperatures and shifting rainfall patterns enable these vectors and the pathogens they carry to thrive in new environments. We are absolutely seeing this here in the United States. We're seeing it in the Midwest, where we've got uh, mosquitoes lasting a lot longer into the year than they have maybe historically. We're seeing this with the types of diseases they're bringing to the area. We've got West Nile virus in new areas than what maybe we've seen and historically in previous regions and years. So there's lots of examples of kind of evidence where we're seeing this. Globally, 58% of infectious diseases have at some point been worsened by climatic hazards such as temperature rise and altered precipitation. Specific conditions like floods creating mosquito breeding pools have been linked to increased incidences of things like malaria, West Nile virus, and so on. There's a great kind of Vox News story if you're someone that likes to engage in alternative sources of information. Fox News story highlights Brownsburg, Texas, which is facing a mosquito-borne disease inland driven by rising temperatures and wetter conditions. And so this is a great example, kind of outside of the scientific literature where we're seeing kind of the narrative of a early U.S. example of climate-induced vector spread. In Bangladesh, we have seen over 3,000 cases, almost 30, or excuse me, not 3,000, over 34 approximate cases of dengue fever cases in early September 2025. They're overwhelming hospitals, with experts attributing the surge to climate change driven mosquito expansion in urban water stagnant areas. Other things we're seeing that are indirect health impacts are like waterborne and foodborne diseases. So as we experience more intense rainfall, incidences of flooding, and other kind of temperature variability, we're seeing an increased risk in diarrheal diseases. And so that's due to the pathogens that are spread through water and food supplies. And this is especially problematic in areas where sanitation is already kind of challenging to facilitate in communities. Areas where sanitation is maybe already a little bit compromised. Climate change weakens food systems, leading to reduced food security, undernutrition, and other kinds of associated diseases. Some models estimate a net rise of over 500,000 adult deaths by 2050 due to climate-driven food shortages. There's also emerging evidence from the research that shows higher summer temperatures correlate with increased salmonella, E. coli, norovirus, and other foodborne illness outbreaks. We also see nutritional and livelihood stress. That is another form of indirect health impacts. With reduced crop yields and disruptions to our food supply chains, whether that be to storms, droughts, other kinds of extreme temperature events, this is going to increase undernutrition and food insecurity, particularly in low-income regions. Declining nutrition and livelihood pressures are projected to worsen health conditions such as stunting, anemia, and immune compromise. Other ways that we see kind of indirect pathways are things like rodent-borne diseases. Changes to how we use land, so land use and weather patterns bring humans and reservoir species such as rodents into closer contact, and that will elevate our risk of spillover diseases to different parts of even like Latin America. And so it'll be interesting as we continue to study some of these phenomenons to be able to really speak to what is the impact on this. So some of this is kind of research that's in development, and it may be a couple years until we really truly see what is that relationship. The World Health Organization estimates climate change will cause around 250,000 additional deaths annually from malnutrition, malaria, diarrhea, and heat stress between the next kind of 20 years, 2030 to 2050. We're also estimating that this is going to have a significant economic cost. For the US specifically, we're probably talking between $2 to $4 billion a year in direct health damage. The Lancet Countdown reports that heat-related deaths in people over the age of 65 increased by 167% compared to what we saw in the 1990s, with global heat stress exceeding 1,500 hours per person per year and widespread disease from droughts and rainfall patterns. So again, this is a global-wide issue, and we are absolutely seeing the impact here in the United States. If you've met me, if you know me, you know that I am very passionate about Alzheimer's disease and related dementias. So I couldn't pass up the opportunity to talk about specifically how climate change is really impacting older adults, particularly those that have Alzheimer's and related dementias. But we are very much seeing a relationship between climate change with the occurrence of dementia. A recent study in 2024 found that air pollution can lead to higher dementia risk. Multiple systematic reviews, meta-analyses found long-term exposure to fine particulate matter is associated with increased incidence of dementia. The 2024 Lancet Commission now lists air pollution among 14 modifiable risks for dementia. Recent analysis suggests that wildfire-derived PM2.5 may be especially harmful and may increase that risk for developing dementia more so than other types of air pollution. Extreme heat also relates to higher mortality in people with dementia. That's again consistent with what we've already talked about with the impact of extreme heat and mortality. But we've seen in large national data sets have shown that daytime and nighttime heat raises dementia-related deaths. Heat waves substantially increase Alzheimer's and other dementia-related mortalities. Wildfire smoke and short-term spikes can increase the frequency of neural impacts or emergency room visit impacts. Wildfire smoke has been associated with the greater odds of being diagnosed with dementia, and cognitive impairment is significantly at risk when folks are exposed to really high levels of heat. Cohort evidence associates repeated heat wave exposure with faster cognitive decline, the incidences of cognitive impairment. So again, just a lot of evidence to say that these different climate concerns, especially heat stress, is going to worsen the trajectory for folks that are in later life related to their cognition. So I've already alluded to quite a bit of this. Who is most at risk? Older adults are kind of top of the list, a population that we're really concerned about when it comes to extreme weather events and climate change as it relates to direct and indirect health impact. Children are also going to be a population of concern when we think about things like climate change for a multitude of reasons. People with chronic illnesses, pre-existing conditions are going to be a major concern. But we also should especially be thinking about the impact that it has on low income and marginalized communities. So something to think about. Folks that are going to be more likely to be exposed to these extreme events, folks that are more likely to work in high heat kind of environments, especially in summer weather, are going to be at increased risk. Folks that lack resources to be able to evacuate from disaster events, folks that lack resources to be able to adequately cool their home or even heat their home are going to be at an increased risk. And then finally, this one may surprise you. This may be not one you were expecting us to talk about today, but healthcare workers are also a population that's most at risk. So let's talk a little bit about healthcare. So there are numerous kind of healthcare system challenges when it comes to thinking about climate change. Anytime there's power outages, some kind of weather event, whether that be something like a hurricane or flooding, extreme heat risks, this has a significant impact on healthcare as a field, but also the workers themselves, right? Your work shift is going to look very different if you're trying to operate off generators. You have power outages. You yourself, right, are not able to leave an extreme weather event. It's going to have implications. We see supply chain disruptions. I probably don't need to talk too much about this coming out of COVID-19, but we can have supply chain disruptions in terms of our equipment, our supplies, and medications. Medications are especially difficult for folks to access, especially older adults following a major disaster event. Our emergency response capacity gets overwhelmed when these type of major events, right? We're talking about increases that may even be as small as something like 3% are going to have a major impact on emergency response capacity and how we respond to that. And then as a result of this, right, if the work demand is increasing, we're seeing more mortality. We're going to see an increase as well as kind of secondary traumatic stress, um, compassion fatigue, burnout, moral distress. I think that's a big one we're talking about now in the healthcare field. There's going to be a rising needs among healthcare workers related to some of the emotional and mental tolls from these disruptions from these severe weather events. Unfortunately, it's probably not a surprise to hear that we do also recognize that healthcare has a significant carbon footprint when it comes to being a contributor of climate change. And it's not right, it's not intentional, but it's just kind of unfortunately an indirect effect from the kinds of work that we do, the kinds of equipment we use. It is what it is. It's estimated that healthcare probably accounts for approximately 10% of the US greenhouse gas emissions. We obviously use a significant amount of energy, transportation, pharmaceuticals. We contribute to a lot of, right, the waste that's developed in our society. And so a lot of folks are starting to have some conversations about like, what is our ethical duty to reduce impact? What is the healthcare workers, the healthcare system's kind of responsibility to help reduce impact? And what might that even look like? There have been a number of kind of pilot initiatives, some proposed theoretical models for how we can approach this. And I'll talk about some specific examples of where we've seen healthcare systems really kind of make a fairly sizable impact in terms of reducing their contributions to climate change. So some of those mitigation strategies are things like thinking about, a green hospital design and using renewable energy. Sometimes, that does result in a little bit of like a cost forward to initiate. But if you're producing less waste, if you're producing less, you're able to use a different type of renewable energy. Sometimes you're looking at a different cost. And so sometimes that investment can really pay off financially in the long term. We need to think about, how can we procure a sustainable supply chain? What does that look like? What are some different strategies and ways we might be able to think about that? I think this is really hard in healthcare, right? We have to change our gloves constantly. We have, right, to clean and sanitize. We're going through a lot of equipment, a lot of supplies to be able to keep that environment clean. And so just thinking a little bit about what might those changes look like and how might we be engaging in some of those practices. So can we reduce our waste? Can we reduce some of our single-use plastics? Some of those kinds of things are things I would challenge you to think a little bit about. What does that investment look like? What does that implication and adoption kind of look like? Those are some things that we as healthcare workers can advocate for and try to incorporate into the work that we're doing. From a more kind of administration or systems perspective, when we think about adaptation strategies, we also want to think about things like how can we create facilities that are more kind of resilient when it comes to climate events. Can we be thoughtful about what climate resilient facilities look like? When I was working down in South Carolina about a decade ago, I remember we had a really significant flooding event in Columbia, South Carolina region, and it was what was called 100-year flood. We had many of them after this 100-year flood event. But I remember the hospital did it in one of the rural areas did experience some really significant flooding, and there was talk afterwards, like, could the hospital have been set up maybe in a part of the community that was um, less likely to be exposed to the risk of like the river flooding in that area. But that hospital ended up having to close for a couple of months because it even with the steps that were taken to really try to alleviate the exposure from that flooding, they ended up developing really significant black mold. And so they worked a lot with FEMA to be able to stay operational, but they essentially kind of had a mobile hospital outside of their building while they were trying to deal with their black mold issue. And it had significant impact on that rural community. Um, with they couldn't lose that resource. Um, we also can do things like how we prepare and kind of plan. So running drills for like emergency preparedness for disasters, making sure folks know what their role, what the policies are, what the expectations are when those type of events happen. And then I do think we need to really be thinking about how we train staff and how we prepare our staff for climate related health risks, how they should be prepared to respond on when we have these heat waves and these other kind of climate related events. Being informed, being ready for those is going to go a long way for a lot of our healthcare facilities. As a healthcare professional, you can also do things like educate patients about the impact of climate on their everyday lives, whether that be to talk about folks with like heat safety, what are the things they can do to try to take care of themselves to mitigate some of that heat, whether or not they're at home or they're out in the community. Talk about what to do when air quality alerts take place in your community, encouraging folks to do things like mask up, to limit their exposure to some of that air pollution when at all possible. We can also do things like advocate for climate smart policy, whether that be within our organization or it's broader to even like our local government or our state government, to advocate for policies and practices that are going to support recognizing climate change and the response to that. We may also want to incorporate climate into our clinical practice and just thinking about not only with education, but just even like how we're assessing clients, what does an intervention look like, and thinking about how we respond to some of these climate change events. And then one of the most important things, I think we can all, whether or not our role is specifically to engage in research, but we can gather data and track the health impacts. We can all be citizen scientists in this together in terms of looking at what are the trends that you're seeing within your organization, recognizing, cause and effect in terms of what's happening before, what's happening after related to these different climate events, and recognizing what is the unique impact that this is happening for folks in your network within your community. And so I invite you to think a little bit about that. This is a great case example. This is something that I would highly encourage you to think about, maybe even bringing back to like an upcoming team meeting, or other kind of setting where you're together with some of your colleagues to just talk about, what does climate related weather look like and what is its impact for your patients. This is an example from Sacramento. Summer of 2024, they experienced a record-breaking heat wave with temperatures exceeding 100 degrees for 10 consecutive days. I imagine many of us in many different cities across the US can think of an exact example of this. I know we've had quite a few extremely hot days in St. Louis just this year. Hospitals and clinics reported a surge in patients presenting with heat-related illnesses such as dehydration, heat exhaustion, and heat stroke. The emergency department saw a 30% increase in visits, many from older adults, children, and individuals with chronic health conditions like diabetes, cardiovascular disease, and respiratory disorders. So, what if this was your scenario? What if this was your local community? Um, I would talk through, are you prepared to respond to these needs? How might you mitigate some of this? How might you treat patients if a situation like this? You saw an increase 30% in visits. Um, is there a specific strategy that you might employ there? Um, Within kind of a hospital partnership, this is a great kind of case example. Public health agencies collaborated with that hospital to establish cooling centers across the city. They recognized that there was some inequity in their process. And so, thinking about moving forward, they had kind of planned that within some of their low income neighborhoods, which may be less likely to have adequate air conditioning, may have limited transportation, they needed to really think about how to address that health disparity by can we make cooling centers more accessible in certain parts of the community. And so that was a limitation that they experienced, but they were making a plan to kind of how they would address going forward. So I encourage you to think about that. Where might you have folks within your own local community that might have the greatest need? Who might be an entity? Maybe it's an area agency on aging. Maybe it's a senior center. Maybe it is another kind of public health entity. Is there an organization that you could connect with to kind of make a plan for how to try to help mitigate some of this and address the needs of whatever climate related event is most maybe significant in your own community? I think heat is one that a lot of us can really connect and identify with because for many of us, it's the summers are getting hotter and hotter for where we're located. So this is your call to action. Climate change is a health crisis, but it's also an opportunity. We can act at individual, organization, and policy levels to try to help mitigate this. There are obviously things we can proactively be doing as a society to try to reduce the impact of climate change, but we, of course, can also respond to it as well in terms of how we think about that and what we can do for it. Healthcare can lead in resilience and sustainability. I think it's just a matter of taking the time and investment to really think about that and make those changes. So, in closing, I'm going to leave you with this quote: a ruined planet cannot sustain human lives in good health. You cannot have good health, right, when it's too hot. A healthy planet and healthy people are two sides of the same coin, and that comes from Dr. Chan with the World Health Organization. Before we wrap up, I'm just going to give you a couple of the references for where I pulled the information, especially about the direct and indirect health impacts. I'm sure, a lot of this is really from even the last just like 5 years, but I'm sure we will continue to see really significant evidence coming out looking at the relationship of extreme weather, extreme climate as it relates to the healthcare field. I think that is something that we can absolutely count on and seeing more evidence develop, especially as we kind of are constantly evolving in this world responding to climate change. Once again, here is that QR code for our continuing education. If you would like to get in touch with me, my email address is Allison, ALLISON.Gibson, GIBSON at SLU.edu. And I've also got a number of wonderful resources for you from our SLU Family Center for Healthy Aging. Thank you for taking the time to join us for this conversation about healthcare and climate change. And thank you for supporting our Geriatric Workforce Enhancement Program initiative. Have a great day.